All right. I'm Dr. Rob Coombs, Coombs Chiropractic. We're going to focus on pregnancy breathing. And we're doing this short segment because I want this to be able to be passed around to anybody that you know that's pregnant. This is the most important tip or tool I can give any pregnant mom. And it's one of the most important ways that you can help to ensure that the baby gets lined up at the cervix as well as possible. That's critical because that's a determining factor in how hard labor is and how long labor will be. And that's for the baby and for mom. So, for the record, Christy's volunteered to be patient right now. She's not pregnant, just for Facebook record. But, okay, Tanja. So,
yeah, Mom.
what we're gonna work on is I want you to watch the breathing, because after this we'll post tons of mom's breathing pregnancy videos so you can see them. But what I want you to see is how the breathing happens and what we're going to be working on. So in here, the rib cage sits here on this angle, pelvis sits down here, and the baby takes up all that space in between. And the more pregnant the patient is, the more the baby is compressing all the organs, the blood vessels, the spine, everything. So what we're going to work on is how to relax the ligaments in the body and help to get the baby in a position that is most comfortable for the baby. As you take a deep belly breath all the way in, breathe from down here, you're increasing the pressure in the abdomen, and the baby's going to feel that. And as much as when a stranger in an elevator comes into the elevator and stands too close, you kind of take one of those little side steps to give yourself more room, the baby knows how to get to the position that's most comfortable. And the most comfortable position is always going to be centered, head down, at the cervix. That's normal for birth, and it's the best position for the baby. So if you take a deep breath in, what you're going to be doing is driving your diaphragm down against the uterus. The uterus is going to compress the baby, and when you breathe out, the baby's going to move to get more comfortable in the position, and it will line itself up as ideally as possible. So during the next breath, it'll be a more comfortable experience, and the next breath more comfortable, that the baby will be in the best position, centered at the cervix, in your tummy as possible. Translate that to labor breathing. When a contraction happens, you have a choice. You either fight it or go with it. It's like being in the ocean when a wave comes. If the contraction happens and you're chest breathing, if you're focusing on doing all this chest type stuff, you're doing nothing to facilitate getting your pelvis to change to deliver a baby. So what you want to do is take a breath so that you push the diaphragm down against the uterus. That pushes the uterus and the baby against the cervix, and the cervix is going to dilate and present, and that's how the baby's born. If you don't draw your diaphragm down, you negate all that help. So it's like pushing a boulder uphill versus downhill. You can make it a lot easier on the mom. So when you take a deep breath in, focus on the pants, focus on the pressure down here, and let the breath be below the belly button. The best way to do it is to put your hands here and feel your hands move. Most women, when they do this, will breathe at their chest. So you want to focus. When you're working with somebody, if they do breathe wrong, put one hand up here and tell them don't let that hand move. Focus on this breath. Focus on this hand. Perfect. So just consider, as you take that next deep breath in, the diaphragm's pushing downward, squeezing all the organs in here. And as you relax, it eases the pressure. So the stomach should come up and out like you're filling a balloon. And then as you breathe out, it deflates. And as you do that, when you have a baby, it's going to press the baby down against the cervix. And in that 39th, 40th week, that becomes probably the most relaxing, comfortable thing a mom can do, and the best positional alignment check for the baby. So go ahead, one more time. Take a deep breath in, and all the way out. And deep breath in, push, push, push. And all the way out. If you do that breathing right, you're going to relax the broad and round ligaments along the pelvis that hold the baby like a weight belt, hold the baby up. You're going to relax those ligaments, and that'll allow the baby to shift. And all the ligaments that anchor the uterus to the ribs, to the spine, all the different muscles are all going to work in symmetry to get the baby into the best possible position so that the baby's comfortable, and so is mom. Okay? One last breath. Deep breath all the way in and all the way out. And that's perfect. You pass that along to anyone who's pregnant. If they try that and if they can get themselves to breathe better, they'll sit up and stand up and realize, they'll feel how much nicer that feels for themselves, and it feels nice to mom because it feels nice to baby. So practice pregnancy breathing. We're going to post a video of me doing it today with a mom that was pregnant, and I want you to see and see that difference, see how that breathing works, and then we'll post videos throughout the week of everyone doing it wrong, so you can feel that you're not alone doing it. So appreciate your time. Pass that to somebody who can really utilize and benefit from better breathing. Thanks so much.